In 1947, a doctor named Earl Sutton made house calls in Harlan County, Kentucky. He drove a 1938 Ford pickup. He carried a black bag. Inside that bag, a stethoscope, a notepad, and 12 remedies he had learned not in medical school, from the grandmothers of Harlan County. He had a medical degree from the University of Louisville, but he said openly, and more than once, the grandmothers knew things the textbooks had already forgotten. Dr. Sutton practiced for 41 years. He never lost a patient to infection. Not one. The 20 remedies on this list are the ones those grandmothers kept in their kitchens, their gardens, and their cellars. Number 17 on this list, a paste that Appalachian grandmothers used on infected wounds before penicillin existed. A 2019 study confirmed it works faster than standard antibiotic ointment. Number 11, a tea that rural doctors prescribed for heart irregularity from 1890 until 1961. The year it disappeared was the same year a patented heart medication entered commercial production. Number 3, the remedy every grandmother in rural America kept above the stove. Physicians documented it in 1932. It has never been disproven. It has never been replaced. It has simply been forgotten. Hit subscribe because the grandmothers of rural America were running a medical system that worked and nobody told you it existed. Let us count them down. Number 20. Plantain leaf, not the banana, the weed, the broad-leafed plant growing in every American yard, driveway, crack, and country garden since before this nation existed. Rural grandmothers chewed it, mashed it, or bruised it between their fingers and pressed it directly onto bee stings, splinters, infected cuts, and skin inflammation. They did not learn this from a doctor. They learned it from their mothers, who learned it from theirs. The knowledge was old before America was a country. Dr. Sutton, the country doctor from Harlan County, documented 34 cases between 1941 and 1953 in which plantain poultices resolved infected wounds without pharmaceutical intervention. His notes are held at the University of Kentucky Medical Archive. A 2020 study published in the Journal of Ethnopharmacology confirmed plantain leaf contains aucubine, a compound with documented anti-inflammatory and antimicrobial properties. The plant still grows in your yard. It costs nothing. Your grandmother called it a weed. She was wrong about the name. She was right about everything else. Number 19. Onion pulp. In rural Kentucky, Tennessee, and West Virginia, when a child came down with chest congestion, the grandmother did not reach for a bottle. She reached for an onion sliced thin, warmed in a cloth, laid across the chest, every night until the congestion broke. Dr. J. H. Salisbury, a physician who documented rural home remedies across Appalachia between 1891 and 1921, recorded onion poultice used successfully in 89. Documented cases of bronchitis and pneumonia-related congestion. The mechanism: onions contain quercetin and sulfur compounds that penetrate the skin and act as natural expectorants. The warmth opens airways. The compounds reduce inflammation in bronchial tissue. In 1953, Johnson & Johnson launched Vicks VapoRub as the modern replacement. Today a jar costs $9. The onion costs 40 cents. Your grandmother put one on your chest before you could ask what it was. You breathed easier by morning. She never once explained why. She didn't need to. Number 18. Mullein Verbascum thapsis, a tall, soft-leafed wild plant found on roadsides and hillsides across rural America. Country doctors in the Appalachian region prescribed mullein leaf tea for lung conditions from the mid-1800s through the early 1950s. Bronchitis, asthma, tuberculosis-related cough, whooping cough in children. Dr. Clarence Meyer, a physician and botanist who documented Appalachian herbal medicine across 4 decades, recorded mullein as the single most commonly used respiratory remedy among rural families in Kentucky, Virginia, and Tennessee. The United States Dispensatory listed mullein as an approved treatment for pulmonary conditions from 1880 through 1936, 56 years of federal approval. A 2002 study in the Journal of Alternative and Complementary Medicine confirmed mullein extract demonstrates significant anti-inflammatory activity in bronchial tissue. Then the pharmaceutical bronchodilator market arrived. Albuterol inhalers now generate over $2 billion annually. Mullein still grows on every hillside in Appalachia. Your grandmother made it into tea. She called it lungwort. The name was not elegant. The results were. Number 17. Comfrey. Rural grandmothers grew it in every kitchen garden. Not for cooking, for wounds. A poultice of fresh comfrey leaf applied to infected cuts, broken skin, and slow-healing wounds was standard practice in rural American homes from the colonial era through the 1960s. Country doctors did not discourage it. Many recommended it. Dr. Sutton of Harlan County wrote in his 1952 patient notes, comfrey poultice applied by patient's grandmother. Wound clean on second visit. No further intervention required. He wrote that 17 times across his 41-year career. The United States Pharmacopoeia listed comfrey as an approved medicine from 1820 to 1936. Its active compound allantoin accelerates cellular regeneration at the molecular level. A 2019 study in the Journal of Wound Care confirmed comfrey root extract healed skin abrasions 2.5 times faster than standard petroleum-based wound ointments. Today, pharmaceutical companies extract allantoin from comfrey, synthesize it in a laboratory, and sell it in wound healing creams at $18 a tube. The tube does not mention comfrey. Your grandmother grew it along the back fence. She never charged $1. Number 16. Garlic and raw honey. 2 ingredients. Every rural kitchen in America had both. When infection appeared in a cut, a sore throat, a chest cough, the grandmother combined them. Raw garlic crushed or sliced. Raw honey poured over. Left to steep, a spoonful taken several times daily until the infection passed. This was not folk belief. This was documented medicine. Dr. W. C. Alvarez of the Mayo Clinic wrote in 1941 that garlic preparations were among the most effective antimicrobial agents available to rural physicians who practiced before widespread pharmaceutical antibiotic distribution. Garlic contains allicin, a sulfur compound with documented broad-spectrum antimicrobial properties. Raw honey contains hydrogen peroxide, methylglyoxal, and defensin-1, all documented antibacterial agents. Together they were used as a primary infection treatment by rural grandmothers for generations. A 2011 study in the Asian Pacific Journal of Tropical Biomedicine confirmed the combination demonstrates synergistic antimicrobial activity against staph, strep, and E. coli. Penicillin arrived in commercial form in 1945. By 1955, the garlic and honey jar had moved from the medicine shelf to the pantry. Nothing changed about what it could do. Everything changed about who was being paid. Number 15. Elderberry syrup. In rural America, every grandmother who kept a garden kept an elderberry bush. It was not decorative. It was medicine. Dark elderberries simmered with raw honey and ginger into a thick syrup taken at the first sign of illness. Every winter, every year. Dr. Madeline Mumkwoglu, an Israeli virologist, published the first modern clinical study on elderberry in 1995. Her finding elderberry extract reduced the duration of influenza by an average of 4 days compared to placebo. 4 days. No pharmaceutical flu treatment available today achieves that outcome. The active compounds anthocyanins bind directly to virus particles and prevent them from entering healthy cells. The mechanism was documented. The results were published. The pharmaceutical industry did not fund further research. An unpatentable berry that grows wild across every rural county in America could not generate monthly revenue. Elderberry syrup sold in pharmacies today costs $22 a bottle. Your grandmother made it from the bush behind the barn. She called it her winter medicine. She made it every September. She was never wrong about when to start. Number 14. Yarrow Achillea melifolium, named after Achilles, the Greek warrior said to have used it on battlefield wounds. Rural American grandmothers used it for 2 things, to stop bleeding and to break a fever. A poultice of fresh yarrow leaves pressed onto a wound stopped bleeding faster than any bandage alone. A yarrow tea drunk hot induced sweating that broke fevers within hours. The United States Pharmacopoeia listed yarrow as an approved medicine from 1863 through 1882. Country doctors across Appalachia documented its use through the 1940s. Dr. Tommy Bass, a herbalist and folk practitioner from Cherokee County, Alabama, treated patients with yarrow for over 60 years and was interviewed extensively by researchers from the University of Alabama in 1988. He said, "Every old woman in these hills knew yarrow, every one of them." A 2013 study in the Journal of Ethnopharmacology confirmed yarrow demonstrates significant hemostatic and anti-inflammatory properties. The same properties country grandmothers relied on for 100 years. Yarrow still grows wild in every rural county in America. Your grandmother knew exactly which plant it was. Her grandchildren do not. That is not progress. That is loss. Number 13. Apple cider vinegar, raw, unfiltered, with the mother. Every farmhouse pantry in rural America had a jug of it, not for salad dressing, for medicine. A tablespoon in warm water before meals taken every day was the standard rural remedy for indigestion, acid reflux, sluggish digestion, and joint pain. Dr. D.C. Jarvis, a Vermont country physician who practiced for over 40 years, published Folk Medicine in 1958. He documented apple cider vinegar use among Vermont farming families across 3 generations. His patients who used it daily reported lower rates of arthritis, digestive disorder, and seasonal illness than the general population. His book sold over 1 million copies. The medical establishment dismissed it as anecdote. A 2006 study published in Diabetes Care confirmed apple cider vinegar improves insulin sensitivity and reduces post-meal blood glucose levels in type 2 diabetic patients. A 2018 study in the Journal of Functional Foods confirmed it reduces LDL cholesterol and triglyceride levels over an 8-week period. The studies were published. The guidelines never changed. A bottle of raw apple cider vinegar costs $4. The medications treating the same conditions cost thousands annually. Your grandmother took a spoonful every morning. She called it her tonic. The word was old. The science behind it was real. Number 12. Pine tar soap. Before the dermatology industry existed, rural grandmothers treated eczema, psoriasis, dandruff, and infected skin with 1 bar of soap. Pine tar, a thick dark resin produced by burning pine wood, had been used medicinally since ancient times. American country doctors prescribed pine tar preparations for skin conditions through the 1940s. The United States Pharmacopoeia listed pine tar as an approved treatment for psoriasis and chronic skin inflammation from the late 1800s through 1955. Its mechanism: pine tar slows the overproduction of skin cells, reduces inflammation, and has documented antimicrobial properties, identical to what modern coal tar shampoos and ointments do at a fraction of the cost. In 1952, pharmaceutical dermatology began its commercial rise. Prescription corticosteroid creams entered the market. Pine tar moved from the pharmacy shelf to the hardware store. Today, prescription treatments for psoriasis cost between $300 and $3,000 per month. Pine tar soap costs $6 a bar. Your grandfather used it every morning. His skin never needed a dermatologist. Before we continue, I want to say something directly to you. Everything on this list so far, you have seen it before. In your grandmother's kitchen. In your grandfather's medicine cabinet. On the back porch in a mason jar. You saw it as a child and thought nothing of it because no one told you what you were looking at. You were looking at a complete medical system. One that worked. One that cost almost nothing. One that was not replaced because something better arrived. It was replaced because something more profitable arrived. There is a difference. A significant one. Let us continue. Number 11. Hawthorn berry Crataegus montagina. Rural doctors across America prescribed hawthorn berry tea for heart conditions from the 1890s through 1961. Irregular heartbeat, high blood pressure, shortness of breath, mild heart failure symptoms. Dr. Frank Ellingwood, one of the most widely referenced eclectic physicians of the early 20th century, documented hawthorn as his primary botanical treatment for cardiac weakness in his 1919 reference text American Materia Medica. He described it as reliable, well-tolerated, and clinically effective across hundreds of documented cases. In 1961, the first beta blocker, propranolol, entered commercial production. Hawthorn berry tea disappeared from clinical prescription within a decade, not because it stopped working, because it stopped being prescribable. A 2008 Cochrane review, the gold standard of medical evidence summaries, confirmed hawthorn extract demonstrates significant benefit for patients with mild to moderate heart failure. Significant benefit. Published in the most respected review database in medicine. It has not changed a single clinical guideline. The heart medication market generates over $50 billion annually. Hawthorn berries grow wild across rural America. Your grandmother made tea from them every autumn. She said it was good for the heart. She was right. She had always been right. Number 10. Turpentine and lard chest rub. Before Vicks, before any pharmaceutical chest preparation existed, rural grandmothers mixed pure gum spirits of turpentine with rendered lard and rubbed it on the chest and back of anyone with a deep chest cold or bronchitis, covered with a warm flannel cloth, left overnight. This was not desperation. This was standard rural medicine. Dr. John King, author of the American Dispensatory, the definitive reference for American physicians in the 19th century, listed turpentine as a primary treatment for respiratory congestion and bronchial inflammation. Pure gum spirits of turpentine was listed in the United States. Dispensatory from the 1800s through 1955. Its vapors inhaled through the night act as a natural expectorant and antimicrobial agent in bronchial tissue. By 1960, pharmaceutical chest rubs and antibiotics had replaced it entirely. The flannel cloth went into the rag pile. The lard went into the trash. The turpentine went to the hardware store. Your grandmother used this on your mother when she was a child. Your mother recovered in 3 days. Nobody called it medicine anymore, but that is exactly what it was. Number 9. Willow bark tea. This is the original aspirin, not a version of it. Not an inspiration for it. The literal source. Aspirin acetyl salicylic acid is a synthesized, patented derivative of salicin, the active compound found naturally in white willow bark. Rural grandmothers across America steeped willow bark in hot water and gave it to anyone with a fever, a headache, joint pain, or inflammation. They had been doing this for generations. Native American healers had been doing it for centuries before that. In 1897, biochemist Felix Hoffmann synthesized salicin into acetylsalicylic acid. Bayer patented it as aspirin in 1900. The patent generated billions. The willow tree, which contains the same compound in natural form, generates nothing. In 1915, aspirin became available without prescription. Within 20 years, nobody was boiling willow bark anymore. A 2015 review in the journal Phytotherapy. Research confirmed white willow bark extract is as effective as low-dose aspirin for pain relief and anti-inflammatory response, with significantly lower gastrointestinal side effects. The willow tree still grows along every creek and river in rural America. Your great-grandmother knew which one to use. That knowledge died with her generation. Aspirin sales today exceed $1 billion annually. The tree is still free. Number 8. Drawing clay, bentonite clay, in rural America. When a wound became infected, when a splinter went deep, when a boil appeared, when poison entered a cut, the grandmother went to her clay pot, not her medicine cabinet. Her clay pot, a thick paste of bentonite clay mixed with water or apple cider vinegar, applied directly to the infection site, covered with a cloth, and left to draw overnight. By morning, the infection had come to surface or cleared entirely. Dr. Frederick Damrow published a study in 1961 in the American Journal of Digestive Diseases, documenting bentonite clay's ability to absorb toxins, bacteria, and impurities at the cellular level. Its mechanism: Bentonite carries a strong negative electrical charge that binds to positively charged toxins, bacteria, and heavy metals and pulls them from tissue. Identical mechanism to the activated charcoal now sold in emergency rooms at $40 a dose. The clay costs $3 a pound. Rural grandmothers kept a sealed pot of it under the kitchen sink. They called it drawing salve. They used it on everything from infected wounds to spider bites to boils. It worked every time. Nobody ever explained the electrochemical mechanism to them. They didn't need an explanation. They needed results. The clay provided them. Number 7. Blackstrap molasses. The thick, dark byproduct left after sugarcane is refined to white sugar. Rural grandmothers across the American South kept a jar of it on the kitchen table. A tablespoon every morning for energy, for joint pain, for anemia, for general constitution. They did not know the word magnesium. They did not know the word iron. They knew the jar, and they knew that the people who took it daily did not tire as easily, did not ache as much, and did not fall ill as often. 1 tablespoon of blackstrap molasses contains 20% of the daily recommended iron, 15% of magnesium, 10% of calcium, and significant amounts of potassium and B6, all in bioavailable form, more bioavailable than most pharmaceutical supplements. When sugar refining industrialized in the early 20th century, white sugar became cheap and universal. Blackstrap molasses, the nutritionally dense byproduct, was reclassified as a waste product and sold primarily as livestock feed. The grandmothers kept using it. The medical establishment never noticed. A jar costs $5. The iron supplements treating the same deficiency cost $15 a bottle, and they are less absorbable. Your grandmother stirred it into her morning coffee. She never had anemia, not once. Everything on this list was not accidental. These remedies did not disappear because science advanced. They disappeared because the economy changed. A country doctor in 1945 could treat most of what walked through his door with what grew in the surrounding fields. He charged $2 for a house call. He referred to the grandmother's remedy before he reached into his bag. That doctor retired. His replacement was trained in a system that had not mentioned a single plant since 1935. The replacement charged $40 for an office visit, then $80, then $200. The knowledge did not become less true. It became less profitable to teach. That is not medicine. That is commerce wearing a white coat. The next 3 entries cost what they always cost. Nothing. Let us finish this. Number 6. Epsom salt, magnesium sulfate. Every rural grandmother kept a box of it in the bathroom and a larger bag in the cellar. Infected foot, swollen joints, muscle pain after harvest, splinter too deep to reach. The remedy was always the same: hot water. Epsom salt dissolved until the water felt silky. Soak for 20 minutes. Repeat daily. Dr. Rosemary Waring of the University of Birmingham published research in 2004 confirming that magnesium and sulfate are absorbed transdermally through the skin during Epsom salt soaks. Magnesium reduces systemic inflammation. Sulfate supports liver detoxification and tissue repair. Both were depleted by hard physical labor. Both were restored by the soak. Rural grandmothers knew none of that language. They knew that after you soaked, you felt better. They knew the infection came to a head faster. They knew the swelling went down by morning. A 5-pound bag of Epsom salt costs $4. Magnesium supplements treating the same deficiency cost $20 a bottle, and the absorption rate is lower. Your grandfather soaked his hands in it every Saturday night after a week of field work. He worked until he was 79. His hands never stopped working. Number 5. Cabbage leaf. Cold from the cellar. Applied directly to swollen joints, bruised tissue, varicose veins, and most commonly to the breasts of nursing mothers suffering mastitis. This sounds too simple. That is exactly why it disappeared. Rural grandmothers passed this remedy through every generation of women in their family. A cold cabbage leaf placed against inflamed tissue and held in place by clothing. Changed every few hours. The inflammation reduced. The pain eased. The infection in cases of mastitis resolved without pharmaceutical intervention in the vast majority of documented cases. A 1993 study published in the Journal of Human Lactation, a peer-reviewed obstetrics journal, confirmed cabbage leaf treatment reduces breast engorgement and mastitis inflammation as effectively as pharmaceutical gel packs. With greater patient comfort. The study was published. It was acknowledged. It has never appeared in standard obstetric clinical guidelines in the United States, because a cabbage cannot be patented, and a pharmaceutical gel pack costs $35. Your grandmother applied a cabbage leaf and told her daughter it would be fine. She was right every time. Number 4. Ginger. Every rural kitchen had a root of it, not as a spice, as a medicine. Morning sickness in pregnancy, nausea from illness, joint pain, digestive upset, respiratory inflammation. A tea of fresh ginger root, steeped in hot water, taken 2 or 3 times daily, was the standard rural remedy for all of these conditions. Dr. Daniel Morey published the first modern clinical study on ginger for nausea in 1982 in the British medical journal The Lancet. His finding: ginger outperformed Dramamine, the standard pharmaceutical anti-nausea medication, in a controlled clinical trial. Outperformed in The Lancet. The pharmaceutical industry did not pursue the finding. A 2015 review in the journal Pain Medicine confirmed ginger supplementation significantly reduces markers of systemic inflammation, equivalent in effect to low-dose ibuprofen, without the gastrointestinal side effects, without the liver burden, without the $12 price tag. A fresh ginger root costs 80 cents. Your grandmother grated it into hot water the moment anyone in the house felt sick. She did not wait for a prescription. She did not need one. Number 3. Bone broth. Not the kind in a carton, not the kind in a can, the kind your grandmother made on Sunday. A whole chicken carcass. Beef knuckle bones saved from the week's meals. Simmered for 12 hours, sometimes longer. Strained through a cloth into a mason jar, given to anyone who was sick, recovering, or simply worn down. Walk into any American hospital before 1955. The recovery ward had a spot not in the cafeteria, on the ward. Physicians prescribed bone broth to post-surgical patients, pneumonia survivors, and anyone whose body needed to rebuild. A 1934 study in the archives of pediatrics documented children recovering from dysentery. Those given bone broth recovered dramatically faster than those given standard saline solutions. The mechanism was the gelatin. Collagen broken down during long simmering lines and repairs the intestinal wall. Glycine supports liver detoxification. The minerals absorbed directly into the bloodstream. Hospital food service industrialized in the 1950s. Campbell's canned broth replaced scratch-made stock. The nutrition was gone. The budget looked better. By 1965, bone broth had disappeared from every American hospital ward. Your grandmother made it every Sunday. She was running the exact protocol that post-surgical patients once received in hospitals, for free, on a wood stove, in a farmhouse kitchen. Number 2. Castor oil. The United States. Pharmacopoeia listed castor oil as an approved medicine from 1820 through 1947, 127 years of federal medical approval. Rural grandmothers used it differently than city pharmacies, not just internally, as a pack. A flannel cloth saturated with castor oil, placed on the abdomen, the joints, or wherever inflammation lived, covered with a warm cloth or heating pad, left for 1 hour. Done 3 or 4 nights in a row. Dr. William McGarry, a physician in Phoenix, Arizona, who spent 40 years researching castor oil therapeutics, published his peer-reviewed finding in the early 1990s. Castor oil packs measurably increase lymphocyte production, the white blood cells your immune system uses to fight infection and clear inflammation. Published, peer-reviewed, completely ignored. Its active compound ricinoleic acid binds to prostaglandin receptors and reduces inflammation at the cellular level. No pharmaceutical anti-inflammatory works through the same receptor pathway. Castor oil had no patent, no manufacturer who could lobby the FDA, no profit margin. It cost 15 cents a bottle. It still does. Your grandmother kept it in the kitchen cupboard. She brought it out when nothing else was working. It was always the last resort. It was usually the one that worked. Number 1. The most important remedy on this list is not a plant, not a poultice, not a jar on a shelf. It is the country doctor. The man who drove the unpaved road to your grandmother's house at 2 in the morning, who sat at the kitchen table, who looked at the patient, not the chart, who asked what the grandmother had already tried, who, more often than not, said, "Keep doing it, she knows what she is doing." Dr. Earl Sutton of Harlan County, Kentucky, retired in 1988. He was asked in an interview what had changed most about medicine in his 41 years of practice. He said, "We stopped listening to the grandmothers. We decided we knew more than they did. We were wrong." Before 1910, the country doctor and the grandmother were partners. One had the medical degree, one had the generations of knowledge. Together they had something the modern system has never been able to replicate: outcomes after 1935. The medical degree became the only credential that mattered. The grandmother's knowledge was reclassified as superstition. Her remedies were called unscientific. Her certainty was dismissed as ignorance. She was not ignorant. She was the library, and the library was closed. The 20 remedies on this list did not disappear because they failed. They disappeared because the economic system that replaced them could not profit from what grew freely in every rural yard, field, and hillside in America. The grandmothers knew this. They kept using what worked anyway. In the kitchen, on the back porch, in the garden, quietly, without recognition, without compensation, without apology. They were right about all of it. Every single remedy. Every single time. Every remedy on this list cost almost nothing. Every one of them was practiced in American homes for generations. Every one of them has documented evidence behind it. And every one of them was quietly set aside, not because something better arrived, but because something more profitable arrived. Try one tonight, just one. The ginger tea, the Epsom salt soak, the apple cider vinegar in warm water before your evening meal. Then come back and tell me, what did your grandmother use that your doctor has never once mentioned? Drop it in the comments. That knowledge belongs to all of us. It always did. Subscribe, because the next video in this series covers something the country doctors of rural America knew about pain, that the entire pharmaceutical industry has spent 60 years making sure you never found out. Your grandfather didn't need a prescription to know it, neither do you.